All right, everybody. Hello. This is the Rotary E-Club of Silicon Valley, and we come to you each week with our Rotary meetings that are asynchronous. That means that our members will log on sometime between Monday morning and Sunday night and take in the meeting. And we're a regular Rotary club, maybe an E-Club, but a regular Rotary club, which means that folks are going to come to and go through the meeting. They're going to find out kind of what our community, our club is about, what the people are doing, what our different service efforts are, what our social gigs are happening. You might think, really, can that happen in E-Club? Yes. So we are here to do the same kinds of things that every Rotary Club is doing, which is to inspire others to see possibilities in service, to see the joy in service. And for us, there's that extra dynamic of we focus on innovation, entrepreneurship, and education. And so how do these relate to service? How does technology serve the business of service? This is kind of who we are, and we're glad you're a part of it this week. So this week's program, and we record our programs through a video conference recording. What we like to do is we like to connect with interesting people anywhere in the world and record them telling about what they do, ask them a few questions, and then bring that into our meeting. And sometimes that person's fairly local, sometimes a world away. Before I introduce our speaker this week, though, I'd like to give a shout out to one of our members who is joining us. You will see Roger Plested in a moment. Roger, say hello and wave to the camera.
Hi, everyone.
All right, good man. So Roger is a retired lawyer living in Kamloops, British Columbia, and one of the newest members of the club, and we're totally jazzed that he's a part of this recording. So good on you, Roger.
Thank you.
Our speaker is Cecelia Babkirk. Now, Cecelia is the District 5170 Rotary Foundation Committee Chair and a mortgage broker, and just a wonderful human being who's kind of cool to hang out with. And she's somebody who comes to our meetings all the time. She only tells us about it some of the time, which she needs to get over. You always need to let us know you were here because that just helps our club do what is helpful, right? So at any rate, but she is she's a person I'm proud to call a friend, and she is telling us about Rotary's efforts with End Polio Now, giving us an update on where we are with the End Polio Now effort. So with that, I'm going to hand it over to you and do your introduction. Let me know when you're ready, and we'll move to the slides from MIDI screen.
Thank you, Rushton. As Rushton said, I'm Cecelia Babkirk, and I'm the chair of the Rotary Foundation Committee for District 5170. And I'm here to give you an update on the End Polio Now effort. We're going to start with a brief video, about 3 minutes, about eradicating polio in Pakistan, which is one of the last 3 holdouts in the world of eradicating polio. And I think it's important to see because the context really is how challenging it is to go the last inches of this campaign and get this disease eradicated for once and for all. And it also, I think, helps people to understand why it's going to cost a lot more money before we're done. So, Rushton?
Let me jump in. So everybody will have just seen, as we arrange the program, everyone will have just seen that video. So good thing to have started with, and then we jumped into this recording, and you're on.
Okay, great. So are we ready for the slides?
Let's do that. All right, boom.
Okay, so as I said, this will be an update on the polio eradication effort. As any Rotarian knows, this has been the corporate project for the Rotary Foundation for the last 30 years. We hope that the last case of wild transmission of the polio virus will take place this year, and we're making great progress. So go ahead to the next slide. So here's a little history and milestones. When we started in 1988, there were 350,000 cases of polio in 125 countries. As you can see, as we moved along from country to country, trying to do the eradication effort, we really pretty much halved or more the numbers of cases in each year. So it went from 350,000 cases in 125 countries in 1988 to 37 cases in 3 countries in 2016. Year to date, 5 cases in 3 countries. Those 3 countries are Pakistan, Afghanistan, and Nigeria. And Nigeria is only in this list because they had a very small outbreak that was rapidly stamped out last year, but we have to have them in the certification process for the next 3 years. Go ahead. So this is, I'm not going to read every word on these slides, but you can see what the evolution has been of the vaccine effort. And you can see that it took from 1988 to 2015 to have the wild polio virus eradicated in 2 countries. There are 3 strains of the virus. 2 of the 3 now have been eradicated, and they're working on the 3rd, and when that happens, it will be done. And the inactivated polio vaccine was introduced in Pakistan and Afghanistan with the type 1 virus, which is the one that remains. Go ahead, Rushton. So the results are 2.5 billion children with a B have been immunized since the year 2000. They immunize about 400,000 children a year. It's an amazing effort, and if you ever have an opportunity to participate in a National Immunization Day, I couldn't recommend it more. So 15 million people are walking today who would have been paralyzed, and $27 billion have been saved, mainly in improved healthcare and other things. But 17 billion of that is improved nutrition and other intended results. Go ahead. The number of unvaccinated children has declined from 2013-2014 levels. This has been a big oversight effort to try to figure out, given that even in our own country we have people that don't believe in vaccinating children, which children in these developing countries have not been vaccinated so that we could get to them. And I think you can see after watching the video about eradicating polio in Pakistan that it's just an incredible effort. It's door to door, it's passing through transit hubs with the vaccine in cold cases and getting in the back of pickup trucks to vaccinate, any children that are in those. Same thing on the trains and buses. It's just an amazing effort. They hold 1,800 health camps each year. This is, of course, a lot of work, requires a lot of people. Women polio workers are allowed now at the permanent transit points. As most of us know, there have been a number of deaths, unfortunately, due to women going door to door in communities that don't believe they should be doing that work. But still, the program has to work at safe access for all polio workers, because there are always those who will try to undo the work. Go ahead. The last case of wild transmitted polio virus in 2016, that was what we were hoping for, and it didn't quite happen. But there will be, once that last case happens, and we hope it'll now be this year, we'll have a 3-year monitoring effort, and then we'll be able to declare that we have a polio-free world by 2019. But that's only if we all keep working to raise the $1.5 billion needed for eradication. Go ahead. So polio exists where governance and public health systems are the weakest. By reaching every single child, the program provides an entry point for other interventions. And I will say here that we didn't know the unintended consequences of establishing the infrastructure that we have for polio. And one of those interventions was that when Nigeria had an outbreak of Ebola, they lost 60 people in that outbreak, but they stamped it out at that point. And the way that they did that was using the infrastructure that had been established for polio to do the outreach to people who were at risk. And so it was an amazing effort, because Nigeria is a very challenging country to do things like this in. The final push combines the use of better complementary vaccines, higher quality campaigns, and social mobilization. That's probably the most important part, because Often people who are not educated don't understand the reason for these things. But when we no longer see crawlers in the streets of developing countries, we will know that we have done the right thing. Go ahead. So why will it cost so much? That's the big question. There are 150,000 workers and 6 WHO, World Health Organization offices involved in this effort. 400 million children are vaccinated each year. That's almost 500 million children. They continue surveillance activities in 70 countries and work on risk mitigation and sustainability activities. It's not just enough to bring a country from polio-free to polio-resilient to polio-free. You want them to also be polio-resilient so that if there happens to be the one-off case that comes along, they can quickly move in and stop the problem. And then once they've all been declared polio-free, there will be a 2-year monitoring period. So there are 3 endemic countries, 4 outbreak countries. This means countries, in fact, all of these countries that are included in these numbers are countries that border the countries that have wild polio transmission going on. So they have to continue vaccinating, conducting national immunization days every year for probably another 5 to 10 years. India, they figure it will take that long before it's completely eradicated. Go ahead. And so what happens if we stop? This is why we can't stop. We're in it now and we need to stay in it. We would go from less than 100 cases per year to date to 200,000 cases per year in 10 years. And we can't let that happen because it will be back not only in many countries in the world, but it probably will make its reappearance here, which is the last thing that any of us wants. Go ahead. And so I want to thank you for joining us. You have my contact information there. If you have any questions, don't hesitate to give me a shout. And I look forward to the day when we will have fully eradicated this disease. Thank you so much.
Very, very cool, Cecelia. Thank you very much. And so let's do a little Q&A with that as well. You covered lots of really good information. I think that one of the things that we hit with something like this is sense of purpose, sense of scope, sense of urgency. And before I jump in with a question, Roger, if you have a comment or a question, then go ahead and unmute and let's get you in on that as well. So go ahead, Roger.
Thank you, Cecelia, for updating me for what's happening with Polio Plus. I enjoyed your presentation very much.
Thank you.
A couple of comments, and first of all, I cannot stress enough the importance of continuing with our Polio Plus program, because unless we finish the task, the world will always have a problem with polio. The second thing that I would like to ask about is whether or not there has been any consideration by Rotary in regards to the issue of immunization of children in North America. In particular, the doctor in England who falsified his report and issued in the Lancet that said vaccination was also tied up with autism. For those who don't know about that report, it has had a devastating effect, because ultimately the doctor was, because he falsified his conclusions, and he was stripped of his doctorate degree. In addition, he was removed from the British Medical Council, and they also removed his article from the Lancet. But unfortunately, what's happened is so many people in North America have still referred to his report as being the reason why they don't vaccinate their children, which is, in my mind, is absolute foolishness.
Well, I couldn't agree more. And in fact, I know some non-vaccinators. One of my clients is a son of a Rotarian, and they do not believe in vaccinating their children for all those reasons that you mentioned. And Rotary has not specifically addressed that in any way, like doing prophylactic work by doing national immunization days here. But what the trend, at least in the United States, has been that public schools now will not allow children to enter if they haven't had their polio and other vaccinations, just because it's good public health. And so those children, those parents that do not want to vaccinate, they either homeschool their kids or send them to some school private school where the vaccinations are not required. It's unfortunate, but as you know, you cannot force people to do things that make common sense sometimes, and this is one of those things. And so, and I wanted to say about the video about Pakistan, like many Rotarians, was for a long time like, oh really, do we have to keep this up? When is it going to end? You know, we're so tired of being beaten up about contributing for polio. But when I saw that video, it really hit home what a big job it is, and how we just have to keep going at it. And so, and to any Rotarians that are watching this, keep it up. And I want to do a shout out to Rory in your club. For every week, his happy dollars are for Polio Plus. I'm very inspired by that. So I'm a believer much more in the last year than I ever was, because I didn't fully understand the effort that it takes to do this job.
That's very cool. And I think we also face that issue that people encounter when they confuse the individual with the community effort, right? So in a community where everybody immunizes children, if one family decided not to, it wouldn't be any big deal because everyone else does.
Right.
As soon as others begin to, you create the conditions under which people might say, I might end up being exposed to the virus, and then billions of dollars of work go down the drain, not to mention,
right.
lives, of the people affected. But in a similar fashion, when we begin to decide, oh, well, we made this commitment as an organization, but we'll put our money elsewhere. Well, that's the same issue, the individual and the community. Our community is one that has said that we're going to do this thing. And for me, there is this sense of, okay, when you think of Rotary, what do you think of, right? And there's any number of things that it could be, but for a lot of people, what the End Polio Now effort means is that we are an organization that's willing to take on something huge. It's an issue of scope. It's one thing to do small efforts in your community, and I think that we should, and that's great. It's another thing as an organization to say, we have people of all different faiths, and we have people of all different political persuasions, and we come from all kinds of different, kind of economic environments. We are this incredibly diverse group of 1.2 something million people. And yet we all agree that bringing an end to a horrific disease is something that needs to happen, because as soon as one sees the images and understands, it's like, if we're capable, why not? And then also, just for our organization, just for Rotary, as people look at us from the outside, they say, that's that group that made sure that polio was made history, and that's who we are. We're fighting this for the lives of the people who won't get the disease. We are fighting this for the honor of our organization, for the standing that it brings to all of those who would be kind of like, oh, halfway about a job, instead of, no, we're people who follow it all the way through. And it's beautiful. I love that piece in your presentation where you were talking about how the work we had done created a pattern that they were able to follow when it came to the Ebola virus.
Right.
They learned something about our efforts that created this new possibility. I've been talking way too long, but
Well,
one question for you
yes.
it has to do with the immunization drives. I know for a lot of Rotarians, they first really begin to feel it when they've been in one of these places and taken part. Can
Yes.
you speak to those experiences?
Well, it's a massive effort. And what happens is Rotarians go on a trip to one of the places that are still endemic. And just this year, we've had Rotarians in our district who've gone to India. And first of all, to hold a baby in your arms and put drops in its mouth and know that that child will never crawl, meaning in the crawler sense, I think is a very powerful feeling. And plus, when you're in those countries doing the immunizations, you are acutely aware that you and others, Rotarians and health professionals and all, are going to immunize 5 million babies on that one day. That's just an amazing thing to know that you can have that kind of impact or be a part of that kind of impact. But I also wanted to say that in addition to eradicating polio and the Ebola story, is that at some point they went to what they called multivalent vaccines, which included measles, mumps, rubella. So they were not only vaccinating against polio, but against those other diseases. And that has gone a long way toward eradicating those worldwide as well. The job on measles is not quite done, but it's not the same urgency as, the eradication of polio.
Well said. Roger, do you have other comments or questions?
Yes, I do. A couple things. 2 or 3 years ago, in the Fraser Valley of British Columbia, we had a measles epidemic. And what had happened is that a family had gone to visit their family in the United States, and the person in the United States had contacted somebody who had measles, and they passed it on to their cousins, who then came back to the Fraser Valley. And so these things, in terms of immunization, is extremely important.
Yes.
The thing that I would like to stress is that when a lot of people don't realize is that the world has eliminated smallpox. And if we can do it with smallpox, we can do it with polio. The other thing that I must say is that I can remember when being a Rotarian, when the polio and Polio Plus program started. And even today, when I run across former Rotarians, one of the questions that I'm always asked is, how is Rotary doing with ending polio?
Yes.
And people are extremely dedicated and committed to seeing this effort finish.
Yes, for sure.
So,
and can I say one thing about, we have an effort coming up beginning day after the district conference. There's only so much of me to go around, but where we're going to do a polio flash campaign similar to one we did last year. And we are going to ask every Rotarian to give $26.50 to the End Polio Now effort. And where that number comes from, first of all, that's an easy amount. Almost anyone has $26.50 that they can contribute, but that was also the amount of the very first contribution to the Rotary Foundation, which has brought us to this point in the polio eradication effort and in many other good efforts.
excellent. I think our membership will have seen the emails, at that point. So in a sense, most people will see this program after that day, and hopefully contributed as they went, right?
Right, exactly.
So I should say we've actually about hit our time, I believe. However, I'll hand it back over to you, Cecelia, for our last thought in just a minute. Before I do, I want to thank everybody who's joined us this week for the meeting and the program. I want to thank Roger for joining in from Canada. Your story about the measles, I mean, just shows how easy it is. I mean, this is such a mobile world, and that was a powerful one to add to the conversation for sure. When I think about what it means to be a Rotarian, I think about who we are as an organization that can overcome all sorts of differences that prove insurmountable barriers for others, and do really amazing, bold things. And they can be these small, wonderful little things that happen in our communities. They can be these worldwide efforts that inspire others to see the joy in service, right? The joy in living a life of service. So for everyone who has joined in for this, 2 things we need you to do before you finish up. As you go down a little farther, there's an attendance survey. Make sure to do that. We really need to know when people are there. It really helps us out. So do that. If you're in the club, of course, that's your attendance for the week. If you are a visiting Rotarian, then having done that will generate an email that will allow you to pass that along to your secretary for making up a missed meeting. And if you are simply visiting, then just let us know. Just let us know you were here. And then at the bottom, we asked for comments. What kinds of things came to mind as a function of what happened over the course of the meeting, the different pieces of information we shared, the video that you saw before this recording, the information that Cecelia shared with us. What did you think? Respond to others in that space as well. This is a vibrant community, but it takes, that kind of extra step of stepping forward and being part of it as well. But keep coming back. We love sharing stories that we hope will inspire. And with that, let me pass it over to Cecelia for the last word.
Thank you, Rushton. As always, it's been a pleasure presenting to your club. As you know, we are friends, and I'm a good friend of your club, and I look forward to our continued activities both online and offline. But I wanted to say something you said kind of reminded me about a little book that I read that is called One Small Step. Subtitle Can Change Your Life. It's a very simple little book, but it really reminded me that our polio efforts and everything else we do is just by taking one step at a time, one foot in front of the other. When you try to be a world beater, sometimes you fall short, but if you just keep plugging away, you will achieve the goal. So thank you very much for having me.
Excellent.
Thank you, Cecelia.
Thank you, Roger. And thank you all for joining us, and we will see you next week.